So as we've headlined, South Africa will officially receive its first batch of COVID-19 vaccines, we understand, in about an hour's time. But it seems there won't be much protection on the vaccines as they are without barcodes. I'm assuming that's security protection. I want to look at safety issues over the lack of barcodes and what happens after the shipment. Rob Botha joins us from the vaccine, or he is the vaccine supply chain coordinator from the Dept of Health. Rob, good afternoon to you and welcome. About an hour's time, this airplane from India touches down. The vaccines are unloaded. What happens then?
Afternoon, Jeremy, and afternoon to your viewers. 100% correct. We anticipate the vaccines shortly. They will touch down at OR Tambo. They will go through the necessary customs clearance processes and then be transported through to the central storage facility in Johannesburg. From there, samples will be removed from the batch that has been received and sent to the National Control Laboratory, where they will undergo the necessary processes to release the batch for distribution into the country. Distribution will then take place to the designated sites within the provinces, which are administration sites or secondary storage sites.
So from touchdown to when the first person has a needle in the arm, how long do you think that's going to take?
We're looking at around 10 days. That includes all the processes required to get the product through to the National Control Laboratory, giving them time to do their necessary work, then releasing, and then the picking, the packing of the orders, and then the transporting through to the designated distribution or delivery sites in the provinces.
Can I rewind you on a couple of issues? You've outlined the big program, but let's go back to OR Tambo. This aeroplane lands. Could you give us a sense of the size of the cargo? Is there an enormous amount to remove from the aeroplane itself?
No, it sounds like a huge number of vials and a huge number of doses. Understanding that we are getting 1 million doses, which effectively is 100,000 vials. The vials themselves are fairly small, so I think we're looking at around about 2 pallets worth of vaccines that will be arriving. So it's not an enormous quantity when you look at it physically, but obviously that's 1 million doses.
And the actual transportation from OR Tambo then to this secure holding area. My understanding is that these vials don't have to be refrigerated, but I am assuming, Rob, that this would be done under fairly strict security.
Correct. They do need to be refrigerated, but the packaging that they are being supplied in is capable of maintaining that 2 to 8 degree temperature requirement. So the transportation, we are not concerned about that. But yes, there will be tight security around the distribution from the airport to the storage facility.
And then how do you make a determination once it's gone through the requisite testing and is then sent out to the provinces? How is that process going to happen?
So at the moment, the process has been that the provinces, both in the public and the private sector, are submitting their data with regards to the number of healthcare workers and also identifying where those healthcare workers are located. Obviously, we're not going to be distributing directly out of the storage site to all facilities in the provinces. So designated distribution sites have already been identified and also indicated the number of healthcare workers either in that facility or downstream that will be serviced with product from those sites. Based on that, the number of vials will be calculated for distribution.
In my introduction, I made mention of a lack of barcodes for this particular consignment. Is that a problem?
I don't believe it's a problem. There is no way that barcodes are going to prevent theft. A barcode on a product is not a deterrent to anybody stealing a product. What it does do is it definitely helps us to track and trace through the supply chain and identify that the product that you're receiving is the one that you expect to receive purely by scanning the product. That is not a prerequisite for the product. We are only getting one batch, so the product is easily identifiable, and we are able to reconcile what was delivered versus what was vaccinated to determine that we don't have any leakages. Subsequent batches will have barcodes. That is a request that we have made to the suppliers, but we will see when those arrive.
I assume across every element of this very complicated supply chain, you are aware of where the pitfalls might be, where the weaknesses might be. What would your biggest concern be from a security perspective then?
I think from a security perspective is making the supply chain too long. Obviously, every time a product moves from A to B to C to D, the longer the supply chain, the lack of control that you have. So the shorter the supply chain, the better it's going to be for us. Those designated areas that have been identified as delivery points already have pharmacies in place that are used to managing this type of product. So we believe that they are secure and they have the necessary processes in place to keep the product at the correct temperature and in the correct environment.
Rob Botha, just
shortening the supply chain would be it. Sorry.
No, finish your thought, please.
Yeah, no, shortening the supply chain for me is the safest mechanism to avoid too many more complications further down the line.
I'm assuming that this is just a trial, a test case as far as your department is concerned. As you said to me, 1 million might sound like a lot, but 2 pallets, it's easily manageable. Once the process starts moving quicker, your job, I imagine, becomes incrementally more difficult.
Absolutely. And believe you me, this is not a one-man show. There are many people within the Department of Health, in the private sector, the public sector, working very hard to make sure that this works in the provinces. The supply chain personnel, the security personnel, pharmaceutical services working really hard to make sure that this is a success. As you say, this is a test case. So dose 1 is a test case. Dose 2, we will have learned from dose 1, so we'll know where we made mistakes, if there are mistakes, and how to mitigate and rectify them. But obviously, then we need to start planning for phases 2 and 3, which is significant scale up. So that is critically important to the successes, learning from what we've done and learning from other countries. As we get different types of vaccines, as what have other countries done to be able to get this right.
And Rob Botha, while I really, and this is a final question, maybe with a little bit of tongue-in-cheek, but I appreciate the time that you've given us this afternoon, but part of me says that you should be at OR Tambo International Airport with a pen and a clipboard right now.
We have other people doing that for me at the moment. Yeah.
Right. Okay, I appreciate your time. Rob Botha, Vaccine Supply Chain Coordinator from the Department of Health. We're tracking the arrival of that aeroplane and should be in South Africa, we understand, touchdown within the next 60 minutes or so. There is our live flight tracker